Bonsoir, bienvenue sur le plateau de Télé+. Alors ce soir, nous allons discuter d'un topic très important qui est le Multidisciplinary Team, plus précisément connu comme le MDT. Alors aujourd'hui, nous allons recevoir Elmer Cuayzon qui est le Oncology Services Lead et Dr Faisal Abbasakoor, le Senior Consultant Surgeon chez Sicare. Elmer, bonsoir.
Bonsoir, Prima.
Nice meeting you,
Nice
Elmer.
meeting you too.
So, Elmer is a registered nurse chemotherapy with 14 years of experience in the field of medical surgical nursing and 11 years working with the Sicare Downing.
Yes.
Yeah. So, Elmer, can you tell us, can you elaborate about the MDT?
Yeah. So MDT stands for Multidisciplinary Team. And the purpose of this is to formulate a comprehensive treatment plan for our cancer patients by our experts, specialists, clinicians, doctors and nurses, and other health care professionals.
All right. Can you tell us about your role as an MDT coordinator?
Yeah, so my role as MDT coordinator mainly is to schedule the meeting and to coordinate with the core members. So the core members consist of the treating consultant, the medical oncologist, radiation oncologist, radiologist, pathologist, and there can be also other healthcare professionals like nutritionists, psychologists,
Yes.
who's going to be involved in the
All
meeting.
right. Can you tell us how the MDT is conducted?
Yes, basically, the MDT is conducted twice weekly at Sicare Cancer Center, or as per operational demand. Each of the members have respective roles in the meeting. So the chairperson will be the treating consultant, and me as the MDT coordinator, I act as a secretary and documented the meeting. And the other members also give their opinion based on their expertise. And at the end of the meeting, every members will concur the treatment plan based on the discussion.
Yeah. So it's really important to meet up and discuss about everything. So you do that coordination, and then definitely the different specialists, everyone will put on the ideas together to give a better treatment to the cancer patients.
Yeah, it is.
Yeah. Okay. So could you tell us why is the MDT important for a cancer patient?
Yeah. As I've mentioned earlier, the purpose of the MDT is to formulate a comprehensive treatment plan to our cancer patients. So as we know, cancer is one of the leading causes of mortality, not only in Mauritius, but worldwide. So it is important for us to formulate the best treatment plan to our cancer patients. And as this MDT forms the holistic approach of treatment to our cancer patients.
Yeah. So definitely with this holistic approach, it gives more and more, it's very encouraging for the patients, cancer patients, it makes it more easier, I can say, over the medical treatment. Yeah.
Exactly.
Thank you, Elmer, for this insightful conversation.
Thank you.
Alors, restez penchés, on se retrouve dans quelques instants après la pause pub.
Hey, en zo net check me wa même fille. C'est là bon là.
Nice, non?
Net continue à faire des même temps.
Faire.
Maman, l'écoute, Pasteur.
Bien seguido.
Tchou! La mon est bien reconnaître toi. Couleur tout.
Dr. Abbasakoor, bonsoir.
Bonsoir.
Thank you for joining us.
Pleasure. Pleasure.
So can you tell us about the history of MDT?
So it's very interesting. MDT, which is, as you've mentioned before, is this multidisciplinary team approach, which is in our context for cancer patients, originates in the mid-80s when we realized that the treatment of cancer involved more than just surgery, which was the more traditional approach. And with the advent of chemotherapy and radiotherapy, it became important to try and integrate all these treatment in the approach of the patient. And the idea started in Europe and in the United States to integrate all the specialists involved in this patient's care and to discuss the best way forward for that patient. And what made MDT become an international requirement was the fact that it translated in improved survival for cancer patients. So it was not just only integrating the care, just in an attempt to organize the treatment, but the fact that it actually resulted in a better survival for the patient is what really made it so interesting. And as you know now, this is a legal requirement in Europe and in the United States. And during my training in the UK, I was always involved in MDTs as part of the weekly requirement for our patients.
All right. Can you tell us why is it important?
So as I mentioned, not only from historical data that it improved survival for patients, but clearly having multiple opinions and a panel of doctors representing each specialty at the table discussing case not only brings different points of view, but it also brings the latest from each discipline and what may be the best approach for a patient with cancer. So for taking a very simple example, it may be that if a surgeon saw a patient with cancer on his own, he may be inherently biased to go for surgery. But in an MDT, with the radiologist present, the oncologist, the chemotherapy doctor, the radiotherapy doctor, and so on, with a balance of opinion and seeing what the latest research would suggest. In a case like this, for example, it might be seen that chemotherapy before surgery would be an advantage, perhaps with radiotherapy, then followed by surgery. And this would translate probably in a much better survival for the patient than if the surgeon just took on the case and went straight for surgery. And in the same way, perhaps if the patient had seen the chemotherapy doctor only, that doctor could be inherently biased by just starting chemotherapy, when that could be a case that could be cured by a surgical operation. So it's really removing that inherent bias that a doctor may have if he was only individually involved in the treatment of that patient. I just put this in parenthèse that we've had, throughout my training, MDTs also existed for non-cancer patients. And even there, for the approach of inflammatory diseases and other conditions, this consensus of opinion always worked in the favor of the patient. So ultimately, it's getting down the personal egos of each and every doctor to agree to a consensus, which would be the best
for the patient.
And I think for the patient as well, they feel that sense of a greater security, if you want to use that word, or more confident about the way forward, which would reflect all the best international consensus for that particular case. So, I mean, there's no doubt as to the advantages of an MDT.
All right. So could you tell us about your experience?
So, as I mentioned, throughout my training in the 1990s in the UK and early 2000, MDT was part and parcel of our weekly routine. And every single case had to go through the MDT for cancer, whether it was at the time of diagnosis, before the first treatment, for the follow-up of the patient, if there was a recurrence of the cancer, or a relapse of the cancer, the case would be brought forward again for discussion. So for me, it's been always part of my life. Coming back to Mauritius, it was not existent when I came in 2006. So for every patient, I would try and set up a meeting with the oncologist involved, and often we would try and have a one-to-one meeting with the oncologist and the radiologist if necessary, or the pathologist, and try to behave in an MDT manner because that's the way we were brought up. But I was very pleased that finally with the CCare Cancer Center, we formally introduced the MDT concept.
So how's it working right here?
So it's working extremely well. All my patients go through the MDT now, and the patients know that we're discussing their case at the MDT. And because most Mauritians who have had contact with either relatives abroad with cancer or have been abroad with cancer, they are already familiar with the concept of discussing their case at an MDT. So already we've not had a single patient who has refused having their case discussed at the MDT. And when we meet them again, telling them what the MDT has decided, there is a sense of confidence. And perhaps we are seeing less patients going around for second opinions because they already know there's been a panel of doctors involved.
Doctors discussing,
discussing and suggesting what would be. And because our MDT also involves internationally based doctors, there's also a feeling that they are actually getting an international consensus opinion on this.
So, Dr. Abbasakoor, what would be your advice to all those cancer patients watching us right now?
I mean, I think the first thing, it's a difficult thing. There's no point trying to say this is an easy problem. It's a difficult one. But if I could say one thing, would be not to despair, because there has been a lot of progress. And certainly the way we are today compared to even 20 years ago, there's a big difference in outcome. But the message to cancer patients would be to really try and get the best consensus opinion for their treatment strategy based on the latest knowledge available. And with that consensus, not to be narrow-minded in thinking. And this is something that you come across. Some patients think that surgery is the only way out of a cancer, or it should be chemotherapy or radiotherapy. But in fact, for every single patient, the treatment should be tailor-made for them. And I think to maybe have an open mind, but to be really assured that the opinion is coming from a panel of doctors. So I'm coming back to the theme of MDT. And why? Simply because it has been shown without doubt that MDT does increase the survival from cancer, to put it in a very straightforward way.
All right.
Thank
you, doctor.
Well, thank you very much for having me.
Alors, comme le docteur Abbasakoor et Elmer nous a expliqué, donc il faut en parler, donc il faut parler avec les amis, avec la famille, avec votre entourage et aussi avec votre collègue au bureau. Venez faire un dépistage ici à CCare Cancer Center et vous aurez une équipe de médecins qui vont vous aider. Alors, cancer, cause-li, fight-li. Merci, bonsoir et à très bientôt pour une nouvelle émission.